Hello, this is Dr. Gay from First Look MRI, and this is a patient who is 35 years old. He was hit by a truck about 2 months ago. He's had pain in the shoulder ever since. He went to the orthopedic surgeon's office and they did x-rays. They were worried about the top of the shoulder, the AC joint. So they did x-rays here to see if there was any problem, and it looks pretty good. This is the clavicle coming across here. It ends here. This is the acromion process. Part of the scapula. The scapula is this big bone here. It comes this direction, up here, down here, and it has a little bony protuberance here called the coracoid process, so a big, broad bone. But up here is where it attaches to the clavicle or articulates with the clavicle. And there's no widening here, so this looks pretty good. And on this view, this is a view of the clavicle coming across, and we see the acromion here, and right here, this is the AC joint, this little narrow space. And this looks completely normal. There's no widening here. It doesn't look like it's terribly offset, so it looks like a normal association or configuration of the AC joint. So based on the x-rays, things look good, but the pain was significant enough that the doctor was still worried and wanted to make completely sure they weren't missing anything, so they did an MRI scan. And on the MRI scan, we see that there's definitely a problem that was invisible on the x-ray. This is the clavicle coming across. It ends here, and all this stuff here is white fluid and blood products. And this is in the region of the AC joint, so they definitely have an AC injury. We're going to put up another view here to show this better. And in this view, we see the clavicle coming sideways here. It ends here, and the acromion process should be right next to it, but instead it's way down low. So there's a wide gap. And the clavicle, which is here, should be down here this low. Instead, it's elevated way up here. So this is a ruptured AC ligament. The AC ligament holds these two bones together, and when it's torn, this space can be widened. And whenever the clavicle drifts upwards, it's because this is torn, this ligament complex, and also another ligament complex over here. This is the clavicle, and this is the coracoid process. So the coracoclavicular ligaments and broad ligament complex here is also torn. When both of these are torn, then the clavicle can drift upwards. And we call this a grade 3 AC ligament tear. And this is where the clavicle is just free floating, and this needs surgery. And so this is another view where fluid is white, and this really stands out easily now on MRI. We see that there's some brightness in the bone, meaning that the bone is injured, a stress injury or bone contusion, but no displaced fracture. And we see this complex fluid here, some blood products or edema hemorrhage here between the clavicle and acromion. And we see that this area right here, we should see a broad, dark area, which is ligaments going from this bone to this bone, but instead we see this foggy, bright area. And so all these ligaments are completely torn and separated, and this clavicle is drifting upwards, and this space is really wide. Normally this would be down here, instead it's up here. So AC ligament rupture, coracoclavicular ligament rupture, grade 3 injury of the AC joint, and this is blood products. And again, interestingly, on the x-rays, it's just not apparent. So MRI is very helpful to troubleshoot in cases like this. Thank you very much.